Hello, 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 hello. Good evening, good evening, good evening, fellow friends and loved ones. I'm very honored to come to your home this evening. Yes, it's another Sunday again, and I believe that we're going to learn a lot from today's discussion. Yes, we've had so many discussions, we had previous discussions, and last week's discussion was on obstetric brachial plexus injuries, and today will not be an exception. Okay, yeah. So I'm sure that we'll have a lot to talk about. Yes. Today is the 11th of October 20. Yes. To your homes this wonderful evening. Yes. And today's discussion is on the topic adhesive capsulitis or frozen shoulder. Adhesive capsulitis or frozen shoulder. And I'm sure we'll learn a lot from the discussion. So our outline for today is the meaning of the condition that they abbreviated from AC, adhesive capsulitis. So the meaning, and then the various common names that we can refer to the condition as, and then the causes, the categories of the condition called adhesive capsulitis, the risk factors, the population that are affected most. We're going to talk about the anatomy, we're going to talk about the assessment, and then we're going to talk about the treatment. Yes, the treatment and the various treatments, both medically, surgically, and then conservative methods of treating the condition called adhesive capsulitis. Okay, so we are zooming in to talk about the condition adhesive capsulitis. So adhesive capsulitis is a two-word, adhesive and capsulitis. So we read that before this presentation, as subsequent presentation, we talk about some conditions that involve itis, such as bursitis, where we have inflammation of the bursa. This one is also called capsulitis. That means inflammation of something. Yes. So inflammation of the capsule is called capsulitis. And adhesive means, if we say adhesive, it means something that is attaching to something. So adhesive capsulitis means the capsule is attached to something that is not able to move within its available range of motion, that's movement. So we're talking about adhesive capsulitis. Yes. So some of the common names, there are so many causes of adhesive capsulitis, but one of the major cause is aging. So yes, so as one grows, the various parts of the body begin to depreciate in terms of its efficiency, that is ability to carry out its function. Okay, yeah, so one is unable to carry out his or various functions when one has adhesive capsulitis, that is frozen shoulder. So from the few statements I've made so far, I heard that this condition affects the shoulder. So we can have one shoulder affected or both shoulders affected, and that one also would depend on the gravity of the condition. It could be one shoulder or it could be both shoulders. And so before I continue, another name for adhesive capsulitis is called periarthritis. So these are all scientific terms. When you go to a doctor and doctor says you've had periarthritis or you've had adhesive capsulitis, it's not a big term. A common term is frozen shoulder. So your shoulder has frozen. So your shoulder, if you look at this shoulder, so you can see that this is my shoulder. So if I have frozen shoulder, there are some presentation that will depict the fact that I've had frozen shoulder, and we'll be talking about it as time goes on. Okay, so there are so many causes of frozen shoulder. Yes, so many causes, and we can have genetic factors, we can have environmental factors, and these are very important that we take note of. If your parents have had, or your family member has had frozen shoulder, that is the fact that the shoulder is not able to move within its available range of motion, it means you are likely to have that. There are other environmental factors also that we will be considering as time goes on, to be able to appreciate the fact that our environment also can influence us having frozen shoulder. So there are various classifications of frozen shoulder. One, we have primary frozen shoulder and then secondary frozen shoulder, and these are very important for us to be able to treat this condition called frozen shoulder. Yes, primary. So the primary one is actually not we don't really know the cause of this primary frozen shoulder. So people are saying that, oh, it comes all of a sudden, and we can't really attribute to it. So we have patients complaining of pain, not able to raise their hands well, and then night pain. Yes, so this, when a patient is interviewed and asked questions and that says doesn't know what caused the pain in the shoulder, we can classify it as primary frozen shoulder. And then the other one is also called secondary frozen shoulder. The second frozen shoulder can be as a result of so many conditions. Some could be as a result of surgery. So when the patient has had surgery in the shoulder, that is post-surgery, there could be a tamper with some structures in the shoulder involving the capsule. So some pictures will be shown to you as time goes on of what and how the capsule looks like. So the capsule is in the shoulder, and it's a very important structure that connects the arm to the shoulder, that is the scapula. So the scapula is behind the body. So just behind this part of my chest is the scapula. So it's a bone that fuses and connects the arm for us to move up and down. And this connection is made possible by the capsule. The capsule allows the connection of these two bones together. That's the scapula and then the arm, or in a scientific term we call the humerus. So when this happens, that is, surgery is involved in the shoulder. Tampering the capsule could cause frozen shoulder. Also, post-stroke, so a patient who has had a stroke before is likely to have a frozen shoulder. There are other likely conditions such as trauma. So it could be that the person has had an accident and involving the shoulder, so a high impact accident such as sports, that is high impact sports, and then also we could have that is high impact sports such as boxing. So imagine a boxer blowing the shoulder, it could injure the capsule, and then this will cause the capsule to get inflamed, and we could have frozen shoulder. So in term, we have three main subcategories of the secondary frozen shoulder. So just to brief, we have the primary frozen shoulder, we have the secondary frozen shoulder, and some factors that could cause the secondary frozen shoulder as post-surgery, after surgery, and then after an injury, that's post-injury, and post-stroke. Three main subcategories of the secondary frozen shoulder. They are systemic, intrinsic, and extrinsic. So when we talk about systemic, it means inside the body. So there are conditions that could influence a patient or a person to have frozen shoulder. We have one, diabetes is a very, 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 very important point. So if someone has high sugar level, the person could have the metabolism rate, that is ability to produce sugar at a high level, influencing the capsule being affected, and this could result in frozen shoulder. We have other factors that is a secondary to frozen shoulder as extrinsic. When you talk about extrinsic, we have factors such as injury to the neck. So we have a condition such as cervical disc disease. So when you have a problem with your neck, that is the bones in your neck, they could influence or they could impact on the nerves that connects down there to the shoulder, and then it could result in frozen shoulder where you're unable to raise your hands well, and then you have pain in your shoulder. You could also have fractures, that is when you have break in the bone in the arm. This could cause frozen shoulder. We also have a condition we call arthritis. So when you talk about arthritis, it means there is depreciation in the structure that helps to allow the bone, that is the arm, to join the shoulder, the shoulder blade, that is scapula. So we have arthritis of the shoulder. This could also cause frozen shoulder. Okay, so now we're talking about the prevalence. When we talk about prevalence, we talk about which people are mostly affected. That is, according to research, it's stated that women are more predisposed to frozen shoulders. This is because women tend to achieve menopause at an early stage, and then this influences a lower production of hormones, and then hormones that could help to stimulate the function of various systems, and therefore when this happens, it predisposes women to have frozen shoulder at an earlier stage compared to males. Also, ages ranging from 35 to 60 years or 35 to 65 years persons tend to have frozen shoulders, and this is because research has said that they are most active years of the person or the individual, and so they are vulnerable to frozen shoulder. And then this study was conducted in China and Japan because these people are very active in the industrials in the society. Also, we could have the shoulder joints being affected. That is, both shoulders being joint affected. So just look at some pictures so that we can appreciate this condition very effectively, and then we can share our comments as time goes on. Okay, so just a minute so we can appreciate this condition. Yes, so let's look at the okay, so we want to look at the condition as a noun.